over a century, St. Luke's has shown their commitment to healthcare in our community, not just through patient care, but also with the education they offer. On tonight's episode of Health Now, we'll learn why St. Luke's is consistently ranked one of the top teaching hospitals and how their programs are cultivating trusted medical professionals. I'm Ashley Russo, and this is St. Luke's Health Now. Coming up on this episode of Health Now, an in-depth look at medical education programs offered at St. Luke's University Health Network. Stay tuned. Thanks for joining us. Our first panelist here tonight is Dr. James P. Orlando, who serves as the Chief Graduate Medical Education Officer at St. Luke's University Health Network in Bethlehem. Dr. Orlando earned his Doctor of Education degree in Corporate Learning Leadership from the University of Pennsylvania. He also serves as an adjunct professor at Moravian University and the University of Pennsylvania, and serves on several national boards, including the Institutional Review Committee at the Accreditation Council for Graduate Medical Education. Thanks for being here, JP.
Oh, thanks for having us.
St. Luke's is really committed to education. Tell me about this pledge and this commitment and why you have such a passion for medical education.
I think it goes back to our whole history that we have at St. Luke's, starting in 1872. And I love telling this story to all the new residents that we get in about, like, in 1872, how St. Luke's started. And if you look at some of the archives for how the hospital, at that point, the small hospital was staffed at that point, it was all visiting physicians from, like, New York City, from Philadelphia and that. And so one of the interesting things is that we only had one physician at the time, and that was the superintendent. And all the other care was provided from the other physicians coming in from New York and Philadelphia. And so when you're reading some of the archives, you can see that they're bringing in students, medical students, they're bringing in nursing students, they're bringing in residents, more advanced students, which we would call today residents. And so the one thing I love about St. Luke's is that it has this history. It's in the fiber of the place, you know, to actually train the next generation of clinicians, physicians, allied health professionals, all that. And it goes back to, 1872. I mean, it's a rich history, and it really shows. And even going back to the nursing school, it's the longest continuous running operating nursing school in the country, right? And so that is pretty special for the Valley to have that. And so, I mean, it's in the fabric of the place. And part of what, the passion that I have for medical education is that, these are ripple effects that help our community out. So, like, you look at the Community Health Needs Assessment Report, what's needed in our community, primary care, dentists, all these different specialists, and it's just great to know. And I'll tell the residents this, that, like, it's just great to know that, someday you might be caring for me, and caring for my family, which is actually happening at one of our sites up in Hazleton. My dad sees one of the residents that we trained, which is just outstanding.
How awesome, totally
so
full
awesome.
Circle. And as you said, it's really amazing that St. Luke's has been committed to education really from day one. There's just a little more formality around it now.
Yes. Right.
Great, thanks for being here. Joining our panel next is Dr. Shadden Eldekar-Hein, who serves as the Senior Associate Dean of the Temple St. Luke's School of Medicine, the Lehigh Valley's first and only four-year medical school. She is a Temple School of Medicine alumna and an internal medicine physician who's passionate about hospital-based medicine. She also holds a master's degree in bioethics and has received numerous awards for her teaching, research, and faculty service. Dr. Eldekar-Hein, thank you for being here.
Thank you so much for having us.
St. Luke's introduced the Temple St. Luke's School of Medicine in 2011. As the dean, tell me a little bit about what these last few years have been like and what gives you the most satisfaction about running a med school.
The medical school has been a great evolution in St. Luke's medical education journey as a whole. Although the school started in 2011, the idea behind it was years in the making, and the idea behind it was to create a pipeline for physician shortage in the area. So being on the receiving end of that and being the medical educator to these amazing students is quite a blessing.
It's one thing to teach students the actual medicine, but what about all the other pieces, the importance of community, the soft skills, that patient relationship? How important of a role does that play at the Temple St. Luke's Medical School?
I think that's actually sets us apart at times in terms of medical education. And so we are a smaller school, so we have 40 students per class, and we're a regional campus of the larger parent campus in North Philadelphia. So that smaller school class size allows us to create that family atmosphere that's well known to St. Luke's, that caring, to care for their employees. We care very much about our students. And in addition to our students, we care more so for our community. And so part of engaging our students is getting them involved in the community, whether that's through the school districts and mentorship programs or through our free clinics, food shelters, providing free clothing. One example of something that our school has implemented is a free clinic in the Allentown area. It's a student-led interprofessional clinic. So that's what's been important in our school in general, is examples like that that show our commitment to the community.
It's really excellent what's going on with the School of Medicine and with medical education at St. Luke's. Thank you both so much for sharing your expertise and why you do what you do. We'll be right back after a short break, but before we do that, let's check in with Megan Augustine out in the field as she discusses the benefits of using simulators in their curriculum.
Hi, my name is Megan Augustine. I'm the director for the Network Simulation Center as well as a 3D Print and Innovation Lab. We have 4 physical Sim Center locations spread throughout the network. So simulation is an accepted educational modality for anybody in healthcare, whether it's somebody on the clinical side or the non-clinical side. We'll work with anybody that ideally at the end of the day wants to improve that experience for not just our patients, but also our family as well as our community. So a simulation center, it could be any type of environment. What makes it unique is that it is a safe, non-threatening environment for our learners. Whether it's a new skill or a skill that they do on a regular basis, it lets them improve their confidence and competency prior to working with actual patients.
Hi, my name is Steve Makos. I am the clinical educator here at the Bethlehem Emergency Department. The simulation environment is vital to clinical education because it gives the learner the opportunity to practice in their live space with their coworkers, with the equipment that they use in a real live environment. The goal is to maximize reality for these learners. The Sim Lab gives us the ability to put those learners as close to reality as possible.
Every single day, anybody working in healthcare, we're having them make these decisions at a second's notice. It sounds sometimes gruesome and it sounds sometimes, invasive, but in order for them to perfect their skills and have that confidence in their skills, we have to provide that environment for them to practice in. They're better prepared for it and have that confidence to go ahead and do it.
The great thing about the Sim Center is that they're able to adapt and flex to the needs of the educator. When a learner thinks about trauma, they think about injuries, they think about blood. And these are areas where the Sim Lab excels. They make those items as real as possible for that learner, so that learner's feeling what they should feel in reality in that simulated environment.
So there's a variety of skills that our learners can learn when they come to the Sim Lab or when we go to them. But also there's their interprofessional skills. There's the team building skills. That's improving the confidence and getting that skill down, but then having that conversation with that patient, letting them know that they're going to be okay or addressing any concerns that they have.
So these learners are doing these tasks, these items, performing care on these patients in these simulated environments, but they're doing it more importantly as a team together.
Possibilities are endless in terms of the skills that they want to learn. One thing I love about St. Luke's is the investment, the time, the work that we do with all of our learners across our network, giving them the opportunity to practice these skills. It's not just how they did in the simulation, it's also to talk about what they did afterwards, what they could do better, what they could do differently. Whether they're coming to one of our physical locations, we're going to them on the floor or on the unit, or if they don't have that luxury to do either one of those things, then we have a 34-foot simulation truck that we can take into the community. So it truly is a simulation center on wheels. So one of the things that I absolutely love about St. Luke's is the ability to create innovative development opportunities to essentially improve patient safety and better outcomes for not just our patients, but their families as well.
The Sim Lab here at Bethlehem is an excellent resource for new learners. It takes you out of the classroom and puts you in the real-life environment where you can practice skills together as a team in a real-life environment. This is the apex of education.
Welcome back to St. Luke's Health Now. Tonight we're discussing medical education and the many advances offered at St. Luke's. We want to thank you, our viewers, for tuning into our program and for submitting personal questions to be answered later in the show. Joining me are Dr. Orlando and Dr. Eldakar Hine, who are both experts in medical education. All right, let's learn a little bit about what's going on at St. Luke's. JP, I want to start with you because we're talking about medical education, but there's actually graduate medical education. What does that encompass for those of us who may not know?
So graduate medical education is when you have medical students who finish medical school, 4 years of medical school, and then they go on to pick what their discipline is. And so that could be pediatrics, family medicine, general surgery, internal medicine. There's a whole host of core residencies that they can go into. And they'll decide that in the last 2 years of medical school where they want to go, and then they enter into what's called this national match program, where they interview at all these different programs around the country in the specialty that they're interested in. And so then they match into those programs, and then the programs or the institution picks them and matches with them. And so when they start residency, it's really hands-on. So they are seeing patients, they are touching patients, they are communicating with patients much more interactively than when they do as medical students. And so they're growing all under supervision, obviously, elbow to elbow supervision, especially at first. And then gradually they will gain a level of autonomy as they go through their program. And so again, there's a whole bunch of core residency programs. Once you graduate medical school, you go into this residency, and you really learn like the hands-on stuff around medicine. And so like pediatrics is like 3 years, family medicine is like 3 years, general surgery, orthopedics is 5-year program. And again, as time goes on, you learn how to do all these things so that when you graduate on the other end, on the other side, that you're able to practice independently.
You're really ready. There's so much training that goes into
Yes.
it. Med school is sort of just the beginning.
Yes.
And Dr. Eldakar Hine, you mentioned the physician shortage and the need for doctors. Did that play a role in why St. Luke started a medical school? And, what makes it special and unique? You mentioned the smaller class sizes compared to a larger school. Talk to me about that.
The physician shortage was definitely the reasoning, one of the major reasons why the medical school came to fruition. Initially, it started as a 3-year campus, so the students spent their first year in Philadelphia. Now we've evolved to a 4-year campus, and that 4-year campus allows students to start their medical careers here in Bethlehem and stay there throughout their 4 years. That also allows them to further engage with the community. In addition to our amazing faculty, because I do think that, as JP had mentioned, the graduate medical education program provides an amazing foreground of career advising and advancement. We have our own team located on the regional campus that helps support the students. So in their first 2 years, they're learning the principles of medicine, including like pharmacotherapy, physiology, pathology, and then they evolve into their clinical years where they are supervised by outstanding faculty that cross paths with graduate medical education. The students enjoy that opportunity to engage with their faculty members more one-on-one, and also they see them in their first 2 years as well as their later years, and so they see that longitudinal mentorship and advising come to fruition, and so I think that's what sets us apart. But also, again, our engagement with community is really, that's what we really want to see from our students, and our students come with that engagement, and they really reach out to the Lehigh Valley and in understanding what our community needs from us.
Yeah, it's certainly a unique opportunity to interact with the community in which you're studying. And JP, what are some of the advantages to not only med students but also residents and fellows in their training that they get in that sort of smaller environment at St. Luke's?
They got much more elbow to elbow customized individual learning, which helps them learn medicine in a much more personalized way. And then number two is, I think it's the faculty, right? So the faculty get to share their knowledge with the next generation. The other thing, if I may, it has to do with the culture we have at St. Luke's and the high quality 5 CMS star, rated network, because where you train matters, right? So if you want to be a top 100 physician, top 100 doc, you go to a top 100 network. And you want to be a 5-star CMS provider once you graduate, which are different measures out there, that's where you go, because you learn best practice. And so our students are learning best practice from faculty that have a passion for it and are really, really good at what they do. And that shows out in the numbers. We're consistently rated as a top teaching hospital in the country, and it's those quality measures, those satisfaction measures of residents, like they really matter.
Right, not just a popularity contest. There's actual data being used for these.
There is super data used for these, because these are not, it's not a beauty pageant, like you said. It's hard data, and it really shows that, St. Luke's is a great place to train. And because of that, compared to other places, the physicians that graduate and the advanced practitioners and the nurses that graduate from our programs, like they're going to come out and be more talented.
The best news for our community, right? It's the best news for our community. Okay, Dr. Eldekar-Hein, so now over 10 years, St. Luke's has had this relationship, has had this medical school. How have they parlayed that Temple relationship to create a school of medicine that's relevant to the Lehigh Valley?
So I am a Temple grad, and so I'm very proud to have received my medical degree there. I think the education that I received there was second to none. And the reasoning behind that, again, is medical schools, through accreditation, we teach, again, students to be great physicians. Part of the Temple way is to teach students how to care for their community and to be aware of what their community needs. And I took those values and I bring that to our school as well, which again is our Temple Regional Campus. And so how we utilize that in our own Lehigh Valley is again performing what we need to do in our community, and so that when we're giving back and we're engaging the students in their learning, that they're learning what the community needs from them. And so I do think that Temple Education, partnered with the amazing care that St. Luke's Health Network is known for and awarded for, is probably the best of both worlds when you think about medical education.
Provide such a comprehensive education. And JP, you mentioned culture, and you've both mentioned community. What are the type of relationships that new residents, med students are getting with our community and with their attending physicians? Because a lot of times you study for a number of years and not even get to the chief of surgery or anything. What happens at Temple St. Luke?
So one of the things we did several years ago, we started 2 rural residency programs up in our Miners campus, Carbon campus, Lehighton campus, Geisinger St. Luke campus area. It's like a northern region, rural regional area. And so we started 2 programs up there, a family medicine rural residency and a psychiatry rural residency, very much based off of community needs assessment. And you need that pathway for physicians and other learners up there. So it's been tremendously successful. But one of the other things that has really made it such a place that the residents gravitate to is because there's so much community interaction. And so that helps them want to stay. So in a lot of cases, we'll have applicants who are from that area say, I want to come back here and I want to be a physician in this area, like we've had several times. And they go through our either medical school and or residency programs, and then they end up staying and opening up practices in there. And that is just, they want to give back then, and they'll participate more in the different kind of community activities that they'll have up there. It could be something as Meals on Wheels. It could be, the opioid, education that they provide, within the community. Even working extra office hours to see, all the different patients that need care, like after traditional hours. It's just such a great story, and to see those students and residents who go through our programs and then want to stay here speaks volumes for not just St. Luke's, but the community that they live in.
Absolutely, and it's so important because we think about how sort of big the Lehigh Valley has gotten, but we have a lot of smaller regions connected to us, and it's nice to see everyone giving back. Dr. Eldekar-Hein, one of the biggest barriers in going to med school, cost. Tell me a little bit about the impact scholarships have and how prevalent scholarships are at Temple St. Luke's to make graduate medical education possible.
Yeah, of course. The cost of medical education is on a lot of students' minds. The average debt that a student holds after medical school graduation is over $200,000. And so the students are really looking for opportunities to offset that. And when I talk about recruitment with the students, oftentimes I do talk about our amazing endowment. And that endowment is made possible from the generosity of our community, of our faculty. What I remind the students is this is the community and the faculty's commitment to supporting them, just as it is our faculty's role to support them through their education. And so the endowment leads our students to offset their education by $10,000 per year over their 4 years. And again, this helps offset a lot of that debt that they're leaving school with. In addition to the endowment, the St. Luke's does also offer scholarship and further debt relief to students pursuing careers that are necessary and needed in our community, such as primary care, which includes outpatient internal medicine, family medicine, psychiatry, pediatrics.
I'm glad you're bringing that up because that is an important program. So there's multiple mechanisms to help offset some of that debt that students have in as they start their residency training. And so special type of programs like that really help that, which is different than what other places offer. And that's, again, really kudos to St. Luke's and the donors that we engage with, our faculty.
Yeah, another unique offering incentivizing students to go to medical school in the first place. JP, I just want to touch on something. You mentioned accreditations and accolades, awards. St. Luke's University Hospital became the nation's #1 teaching hospital. What goes into getting that accreditation? How important is it to the success of your students?
That is a recognition that comes from the national bodies, and so that just looks at our quality measures, our patient safety measures, which we have just an outstanding quality patient safety department with Donna Sable leading that, and we work very closely with her department to get residents involved in it because, again, where you train matters, and so if you want to be a top 100 doc, go to a top 100 hospital. And that's an environment and a culture, I think, that Donna Sable and with leadership from Rick Anderson and Robbie Wax have really, and the hospital presidents have really propelled into the system so that we have this high, a high reliability organization, they call it, which just have these outstanding measures. And so what goes into that is our quality measures, like I was talking about, operational efficiency or financial performance and satisfaction of our patients and the satisfaction of our learners and the satisfaction of our staff. I mean, all that really, and that's another reason why you have St. Luke's being recognized as a top workplace just last week with a major award and a major recognition. And these are things that are not necessarily sought after, but the data doesn't lie, and we get recognized for those things. And it just says a lot about the place.
Medical students at St. Luke's are receiving the highest quality education to better serve our community. Up next, we have some questions sent in from our audience. We'll get to those right after this short break. Stay tuned.
I believe the most important thing that sets St. Luke's School of Nursing apart from other programs is the support that students have here within the network, the employees, the administration, and every student receives a faculty advisor who is in their track. Many times students feel that we're like a small family, support for them.
St. Luke's has been named a top 50 cardiovascular hospital in the country for the 8th time, and we're in good company. St. Luke's has the only local heart care team to be ranked in the top 50, along with Mayo Clinic and the University of Pennsylvania. This means our heart patients have higher survival rates, fewer readmissions, fewer complications, and better patient experiences. Using the highest quality healthcare standards, no other hospital in the region has better heart care. St. Luke's, my heart is in the right hands.
Welcome back to St. Luke's Health Now. I'm your host, Ashley Russo, and we've had an engaging conversation about medical education at St. Luke's University Health Network. Thank you to our amazing panelists. Now it's time to answer some questions from our audience. All right, Dr. Eldekar Hein, I'm going to start with you. My son is a high school freshman with plans on becoming a doctor. How difficult is it to get into medical school, and what practical advice would you give an aspiring high school and college student who shares this dream? Great question.
That is the question I get a lot. And so, like any career that's as rewarding as medicine, it has its challenges. But what I would say is, as to a high school freshman, is always to enjoy your time while you're there and engage in sort of the citizenship around the school and the community. I do think what we see in our students, which I think is incredibly important, is their understanding and commitment to serving the community. And I do think that's something that you can get involved in your high school years. I also think that getting involved in leadership, whether it's around student council or just finding a passion, and it doesn't have to necessarily be healthcare related, it can just be a passion of theirs in taking sort of ownership over that and accountability and leading some of the charge and what they can do, but also then setting themselves up for a great undergraduate institution that will build on high sciences and prepare them for their entry exams for medical school.
Yeah, it's sort of very important to take the right classes and do well in them, but I love that sort of civic community engagement piece, so important as well, and you can do that in a variety of ways. All right, JP, can you explain the difference between residency programs and fellowships, and why do some doctors need to complete both?
So after medical school, you go into these core residency programs, and to sit for the boards and get licensed and get board certified so you can go practice independently. Some physicians decide that, you know, I really love this area of internal medicine, or I love this area of pediatrics, and I want to subspecialize in this area. So I want to subspecialize in, you know, pulmonary critical care, or I want to subspecialize in critical care medicine. Like, those are my focus areas. Or I want to subspecialize in endocrinology or rheumatology. And so that allows them to really do a deep dive into those content areas, which could last from anywhere from 1 year to, you know, a 3-year training program. And the reason why they would have to do both is because in order to do the fellowship, you have to do the residency. And so they're kind of, they're building blocks. They build off of one another.
Or of a subspecialty within a specialty.
Yes, correct.
Okay.
Absolutely.
All right, Dr. Eldekar-Hein, I think you sort of covered this, but this viewer asks, when interviewing medical school applicants, what makes someone stand out above the rest, and what qualities are important at St. Luke's?
I talk a lot about community engagement, but I think the most important aspect of that is hearing from our community. So the compassionate listening that you receive and acquire from being with our community members, hearing what they need, seeing sort of how they live their lives and how you can contribute to the health or healthcare environment in that. So I do think that community engagement really is something we're looking for because it shows us that as they become physicians in the future, that they understand what our patients need and listen to those needs. And
yeah,
so I think that's really important.
Really a calling, not a job, and important to figure that out.
80% of all of our healthcare costs are in some way tied to what they call social determinants of health. And so that has anything to do with food insecurity, transportation, housing, a whole list of things. And so the reason why the community piece is so important is so that our students and our residents understand and learn about what those social determinants are that our community goes through. And that makes them better practitioners and communicators with the patient. So, you know, that's 80% of our healthcare costs are tied to those social determinants of health. That's a big number. And so I think that's another thing that really kind of differentiates the focus of the medical school specifically.
Absolutely, and very important that St. Luke's is taking the time to make sure students understand and get involved in the community in a meaningful way. Thank you both so much for being here. Thank you for all the great things you're doing for our community. And thank you for preparing the doctors that I think will take care of me and my friends as we age. So thank you so much. For more information on medical education and programs offered at St. Luke's University Health Network, please visit their website at sluhn.org or call 1-866-ST. Luke's. Thanks for tuning in to this special episode. We hope tonight's program leaves you feeling informed, inspired, and most importantly, empowered. I'm Ashley Russo. See you next time on St. Luke's Health Now.